This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, March 10th, and I'm Zach Caruso. Our lead story this week is in Addiction and is titled, Does the Total Consumption Model Apply to Cannabis Use? This repeated cross-sectional study based on annual surveys tested whether the total consumption model and its extension, the theory of collectivity, apply to adolescent cannabis use in Sweden. Frequency of cannabis use was measured by a question on how many occasions the respondent has used hashish or marijuana. The 7 response alternatives ranged from 0 to 50 times or more. Increases in mean frequency use were associated with a higher prevalence of high-frequency users. Adolescent cannabis use in Sweden appears to conform to key predictions of the total consumption model and its extension, the theory of collectivity. Next is an article in JAMA Network Open titled Overdose Prevention Centers and Neighborhood Commercial Activity in New York City. Only 3 publicly recognized overdose prevention centers, or OPCs, currently operate in the U.S., 2 in New York City, which opened in November 2021, and 1 in Providence, Rhode Island, which opened in January 2025. Of the concerns often raised about OPCs is potential for negative impacts on local businesses in the surrounding neighborhoods. This study used neighborhood-level foot traffic and consumer spending to evaluate the economic impact of the opening of 2 OPCs in New York City, 1 in East Harlem and 1 in Washington Heights. Researchers examined anonymized mobility and consumer spending data from SafeGraph, a geolocation analytics firm, to compare observed post-OPC implementation outcomes with comparable areas in New York City from June 2021 to June 2022. The opening of the OPCs had no statistically significant impact on either consumer spending or neighborhood foot traffic, suggesting that the OPCs had no meaningful impact on neighborhood commerce or local businesses. Our next article is in the Journal of Addiction Medicine and is titled Opioid Agonist Therapy for Fentanyl-Related Opioid Use Disorder, a Systematic Review. The high potency of fentanyl has required novel induction strategies around the use of MOUD for patient comfort and to avoid precipitated opioid withdrawal, or POW. This literature review included 180 studies of MOUD induction. 1 study of standard dose induction found 22% of patients had severe POW. Low or microdose sublingual buprenorphine had 34% to 60% success, 2% POW, and 86% 30-day retention. With high or macrodose, 1 study reported no POW and 58% retention at 3 months. Studies described accelerated methadone inductions rapidly reaching doses over 100 milligrams per day. Inpatient inductions allow close monitoring during rapid dose increases. The authors emphasized the poor overall quality of these studies. Only 17 of 180 were RCTs, and many lacked comparison groups. Next is an article in Preventative Medicine titled Route of Drug Use Among North Carolina Drug Overdose Decedents, 2018 to 2023. Information about overdose deaths between 2018 and 2023 was obtained from the North Carolina Unintentional Drug Overdose Reporting System. Overdose deaths increased from 2,046 in 2018 to 4,252 in 2023. Most deaths involved opioids, followed by stimulants, benzodiazepines, and anticonvulsants. Deaths involving multiple drugs appear in more than one category. The route of drug use was recorded in 46% of deaths, with injection the most common, followed by snorting, smoking, and ingestion. The route of drug use changed during the study period. Injection decreased, snorting increased, smoking increased, and ingestion increased. At the end of the study period, the percentage of deaths due to injection, snorting, and smoking were similar, despite the common belief that snorting and smoking are safer. Our next article is in Drug and Alcohol Dependence and is titled Buprenorphine Utilization Following Removal of Prior Authorization Requirements in the Kentucky Medicaid Population. Prior authorization, or PA requirements, often cause delays and/or barriers to medication access. To address this, many states have removed PA requirements for transmucosal buprenorphine. This study seeks to quantify the impact of the removal of PA requirements on transmucosal buprenorphine dispensing in Kentucky. To do so, the study analyzed Kentucky Medicaid claims from January 2016 to June 2023 for enrollees with OUD to assess changes in buprenorphine receipt for OUD treatment after removal of PA requirements in February 2019. There was a significant immediate increase of 4 per 100 enrollees who received buprenorphine after the removal of PA requirements, which then continued at a slower growth rate. Next is an article in MDM Policy and Practice titled Estimating Lifetime Drinking Trajectories for Alcohol Use from Adolescence to Older Adulthood in the United States, a 3-step approach. Alcohol contributes to significant morbidity and mortality, often over a lifetime, but there is limited data on long-term alcohol use trajectories based on use patterns in adolescents. Researchers use Bayesian simulation to calculate age and sex-specific transition probabilities between 4 drinking risk levels, abstinence, and alcohol dependence from 12 to 65 years of age. Overall, high and very high-risk use had greater risks of transitioning to dependence, while low-risk states more often transitioned to abstinence. Authors noted that while additional research is needed to incorporate other demographic factors, these transition probabilities can be used in decision analysis to better inform policymakers about the long-term effects and cost-effectiveness of early adolescent interventions. Our next article is in the Journal of Psychopharmacology and is titled Health Risks Associated with Non-Medical Use of Ketamine in France, National Surveillance Insights from the French Addictovigilance Network 2019 to 2023. This retrospective descriptive analysis of national surveillance data from the French Addictovigilance Network examined ketamine trends in France from 2019 to 2023. It found a marked increase in ketamine-related complications, particularly among young users. Severe urinary and biliary complications, alongside rising reports of ketamine use disorder, highlight an urgent need for awareness among clinicians, systematic screening, and targeted harm reduction and clinical screening strategies. Our final article is in Substance Use and Misuse and is titled, For Whom Does Chemsex Increase Sexual Risk? Considering Pre-Exposure Prophylaxis, Antiretroviral Therapy, and the Dual Control Model. Chemsex, the use of substances specifically to enhance sexual stimulation and for increased euphoric effects during sex, is a significant risk factor for HIV among men who have sex with men. Researchers sought to better understand this relationship and the impact of pre-exposure prophylaxis, or PrEP, and antiretroviral therapy, or ART. Researchers found the majority of chemsex encounters involved methamphetamines and were associated with compulsive sexual behavior and engagement in condomless sex. However, the association with condomless sex was only among those not currently using PrEP or ART. The researchers noted that chemsex was not associated with decreased concerns about sexually transmitted infections. The authors note interventions need to address both the substance use and connecting this population to PrEP and ART. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.